A country of 235 million people, Pakistan is still dealing with the effects of last summer's catastrophic flooding, COVID, and disease. We dive into a new study covering 30 years of health data from 1990 to 2019 from each region of Pakistan. The research reveals the top challenges for decision makers and sparks the conversation on how to navigate the new problems arising from the recent flooding. We're talking about the health crisis in Pakistan today with two of IHME's leading experts in health and the environment. Dr. Ali Muqtad is professor of health metric sciences at IHME and also a senior author of a new analysis on the health burdens in Pakistan. Professor Mike Brower is an affiliate professor at IHME, where his expertise covers climate change and its relationship to public health. Thank you to both of you for joining us today. Dr. Muqtad, let me start with you because you led the analysis on 30 years of health data covering all the provinces and the territories of Pakistan. What are your main findings from this study?
We have seen some improvements in Pakistan, but it's not the same for all provinces and territories. Life expectancy improved in the country, but the gains were not uniform across the provinces and federal territories. And we have seen also that, for example, neonatal disorder, ischemic heart disease, and stroke were the leading cause of premature mortality in the country. And some of the provinces, such as Islamabad, the capital of the country, was the best performer compared to, for example, Baluchistan, which had a lower life expectancy.
And Dr. Muqtad, you give us those comparisons. So there wasn't uniformity in what we saw across the regions. So what was the reason behind that?
So when you look at disparities in health everywhere in the world, and that's true for Pakistan, they're due to four main reasons. The first one is socioeconomic factors, income, for example, and education. And we know everywhere in the world that female education is very important and a strong predictor of health. A woman who's educated is more likely to know the sign of danger for herself, her family, more likely to seek medical care, more likely to adhere to a medical message because she understands it. The second one is access to medical care. The third one is quality of medical care. And the fourth one is what we call preventable risk factors in a setting. When you look at these four combined, there are a huge variation in the country between provinces and geographic location in Pakistan. Take Islamabad, for example. We do something at IHME, we call it socio-demographic index, which is a measure of income, fertility under 25, and education, a good proxy of what is really causing these disparities. Islamabad, for example, has high SDI, whereas other parts of the country has very low SDI.
And we can't ignore the environmental issues here. This study was from 1990 to 2019. So let's bring in Professor Mike Brower here, because the study reveals the major challenges to an already vulnerable population there in Pakistan, Professor. But then on top of that, we had the floods of last year of 2022 to add more complexity to this layer, and it was catastrophic. So looking at the situation, Professor Brower, from the lens of climate, how would you assess the situation in Pakistan now and the domino effect?
So Pakistan's really in this, very vulnerable position. There's multiple challenges. So we see from this risk factor perspective that the country is still facing what we would call traditional risk factors, poor sanitation, unsafe drinking water, household air pollution from cooking with low quality fuels. At the same time, it's dealing with more modern risk factors, things like urban air pollution, poor diets, and then on top of that, it's in this region that is very vulnerable to climate change. So this is what we've seen with the flooding. So we had a severe drought and very high temperatures that led to actually increased rainfall and melting glaciers, which was causing this flooding. So it's getting actually these extremes of climate, both really warm temperatures, which we know have impacts on health, that have led to droughts, poor food security, wildfires, which then creates more air pollution, And then that cycles back into this rainfall pattern that has been so devastating. So we've seen the direct impacts of these floods. It's many people have lost their homes. There's huge parts of the country, really, really massive parts of the country that are still underwater today. So displacing people, people living in very poor conditions, and food security is threatened as well. So really just multiple layers and layers and layers of challenges upon it. And then we see that this is a country that is also not as healthy as many other countries. So that makes the impacts of all things more devastating. If people aren't healthy, they don't have the resilience to actually withstand these kinds of environmental threats.
You're painting a very dire picture, but when you take a look at the broader landscape, do you see any positive trends in terms of climate, especially since climate change is such a big topic globally?
Yeah, I think the positive message, so climate change itself, there's very little positive to say about that. Pakistan and the world is going to be facing with this threat. But the positive is that this has now been recognized. So this really severe impact, that it's well recognized by the global community, it's well recognized by the government in Pakistan. And the hope is as the country rebuilds from these devastating floods, they're not rebuilding for the past, they're not rebuilding for the present, but they're actually rebuilding for the future, rebuilding, taking into account that this is a reality, that they're going to have these extreme temperatures, they're going to have floods, and actually creating a setting where they can actually withstand that. And we know that's possible because the higher income countries of the world are already doing that to some extent. So in some ways, while it's very sobering to say, there's a clean slate for much of the country, and as they look to the future, need to be thinking ahead about the risks that they will be facing for the future.
And another risk that we have, Dr. Mukhtar, is the political turmoil there in Pakistan. I mean, we see the great challenges already stemming from communicable and non-communicable diseases, but there's political turmoil as well. I mean, it's such a complicated picture when you look at the domestic politics and the Taliban in control now over the border in Afghanistan. So are you concerned that all of this will hinder the initiatives in Pakistan that are aimed at improving public health and the environmental situation?
Unfortunately, it will. Yeah, unfortunately. What we're seeing right now in Pakistan, a lot of political turmoil, a lot of demonstration, new change in government, change in the Ministry of Health. And this has been happening for a while. And right now, the return of Taliban will pose a big challenge for Pakistan in terms of security, but also in terms of spread of diseases and the fight to control and eradicate polio. And Pakistan at the same time has financial difficulties. It's a large country, over 200 million, with the inflation right now and the rising prices of food and goods and fuel, for example, is a major concern because people will revert to cutting trees and using woods in order to heat their homes or in order to cook. So Pakistan, yes, will face in the coming years a lot of challenges. But we need to remember that in the past 30 years, Pakistan made some improvement against all odds. And there slow improvement, but there were improvement. And Pakistan is still dealing with unfinished business and agenda from infectious diseases, as Dr. Brower mentioned. And right now we're seeing a rapid increase in non-communicable disease, chronic diseases, heart disease, diabetes, cancers in the country. And the country doesn't have the resources to deal with this double burden at this time with all the challenges that you are mentioning. So unfortunately, Pakistan has some difficult time ahead.
And you mentioned some of the non-communicable diseases that are risk factors as well. Educate us, Dr. Mukhtar, in terms of nutrition policy. Is it made at the regional level or the national level? And is one of the goals to have a national policy?
A combination. So what Pakistan did a reform, and the Ministry of Health right now doesn't have a mandate over the provinces and the territories. So it's like in the United States, the state itself will decide on health policies, spending policies. But the money comes from the federal government, and the Ministry of Health in Islamabad has a role of coordination between all of them. So there is a combination, and that for a while in Pakistan has created some problems when they shifted to move the power to the provinces and territories. It created a little bit of a time where nobody knew what's happening and who's leading. Right now, there is more stability in that regard, and there is more power at the local level in order to administer what's needed at the local government. But unfortunately, because of the political turmoil, you will have a federal government from one party, and you'll have at the provincial level another party, and there is some conflict sometimes. And of course, the people are paying for it.
Yeah, so the people are stuck in the middle. So I'd like to finally ask both of you this question, because it's such a complex situation. If you had the ear of policymakers today, Professor Brower, from a climate point of view, what would your suggestions be today? And Dr. Muqtad, what would your suggestions be from a health point of view? Professor Brower, why don't you start?
Yeah, I would say sort of the first thing is really there needs to be a deeper understanding of the current state, and meaning who is vulnerable and to what. So we layer on top, where do we expect flooding to occur? Where do we expect food security to be threatened? What is the health of people in those parts of the country? So who is sort of facing these multiple challenges? Some of the work that we're beginning now at IHME hopefully will help in this regard. So we're starting to use almost real-time information that we're collecting from satellites to identify crops, identify populations that are migrating, and we can build into that actually our forecasts of the climate, very localized. What will the temperatures be? Will there be areas that will actually be too hot for people to live in? Will there be areas that are going to have such severe rainfall that you can't grow crops? Will there be areas that are going to be too dry to grow crops? And that can help the government actually plan for the future. So as I mentioned, there really needs to be some careful thought, not just to rebuild, what has been devastated, but to rebuild with an eye towards what is that environment going to be for the next 50 to 100 years. And we know it's going to be very, very different.
And you made a great point in our other conversations, Professor Brower, that it's easier to improve the health of a population than to slow down climate change.
Right. So I think we know that we're going to be facing this situation for the next 50 to 100 years. We know also that populations that are healthier are more able to withstand these external risks, these environmental risks. And of course, that improves everything about a country, about its productivity, if the health is better. So, and that this paper really is identifying what the health challenges are, and the more that can be done to actually improve overall health, reduce those disparities across the country, that's going to be a better promise for the future.
And Dr. Muqtad, finally, what would your specific concrete suggestions be to the people who can make change in Pakistan?
I'd like to start first by citing some of the programs that are going on in Pakistan that are successful, and they need to be continued and enforced. One of them is there is a move to provide universal health coverage for every citizen, and they have started slowly and they're moving across the country. So that's a good program that will improve access to medical care and access to quality medical care. The second program, there are many programs, but one of the second programs is there is a network of support that provide financial aid and even food aid to people who are below certain poverty level, and they give it to the women in the households. And this program has been going on for a long time and has been evaluated here and there, and it has shown that it has been very effective in reducing problems that are due to nutrition. So programs like this, if they're well run and they're done very well, they will help a lot in the country in order to limit some of these challenges that they are facing. But in general, Pakistan has to address the burden of infectious diseases. The problems that they are dealing with are very, very huge. And it's a country like other countries, you need to plan for what's really important and in the future. At the same time, you're dealing with immediate needs that you have to address. And that balance between what's immediate right now and what's important is a big challenge for Pakistan to find that balance. Investing in programs to reduce infectious disease, make sure immunization is available for everybody, make sure that women get prenatal care, make sure that kids get adequate food. But I'd like to end on a very important point for Pakistan, especially keeping in mind with Taliban return to power in Afghanistan. Education. I'm so concerned that female education will suffer in Pakistan. I hope not. And I'm so concerned that a young girl who hasn't gone to school for the past 2-3 years because of COVID will never go back to school. Pakistan needs to invest in education, especially female education.
Some great points in this conversation. Dr. Ali Mokhtar and Professor Mike Brower, thank you so much for all of your insight today.
Thank you.